Hmm. All right, we are going live. Okay, I'm Dr. Umar Khan. We will be talking about some of the common questions and I'll be giving you some sample answers. Okay, let me see. Check on YouTube. How am I looking on YouTube? All right, continue to YouTube. All right, so we're going to be going over a couple of common frequency questions. Okay, it's live. I'm going to mute that over there because that's going to interfere with everything that I'm saying right now. Okay, hopefully. All right, mute over there. Excellent. So we are going to be having an excellent session today, and we will be discussing important questions that you will be asked during your residency interview. And this is the start of season, and you need to get the ball rolling correctly, properly, and you need to understand the level of training or the level of the importance of having good formulated answers so that if you have, let's say, around 10 to 20 answers prepared, then you're more or less ready for any of the questions that they ask that are not typical. So you need to go through this flow. You need to make the right you need to make the right you need to have the right answers ready. You need to have the most common questions ready. For example, tell me about yourself, tell me about your three weaknesses, why internal medicine, why family medicine, ethical questions, medical type questions. So you need to be prepared for these types of questions. And we're going to be talking about these questions in this live stream. And if you are joining right now, let me know where you are watching this from, and we can look to address your particular questions, and let's go from there. All right. So I'm going to actually start. We're not going to waste much time because I know everybody's time is very important here. We're going to go over a couple of common interview questions. And the way I like to go about this, and that's how I have it in my program as well, is that I show you a bad answer, an answer that you should not be, at least the people who are following me and watching my videos, they should not be giving these bad answers. And I'm going to give you a good sample answer. All right. And of course, I'll share where you can find templates for yourself as well. All right, so we have a couple of people. So we have an IMG. Let me just share here. We have an IMG watching from Michigan. All right, great, excellent. And let's get started. Okay, let's just remove this for now. I'm going to start with the first question. Why internal medicine? Okay, let's give you a bad answer. All right. Okay. Okay. I like internal medicine because it's broad and I like dealing with different diseases. I think it's interesting to help people with their conditions, and it seems like a good field to be in. Plus, you don't have to specialize if you don't want to. So, I think it's a possible good answer. All right. Well, that was a bad answer. Why was it a bad answer? Well, it was too generic. No details, no examples, no real enthusiasm. Okay, so you need to provide details, you need to give examples. If you're not giving examples, then you could be saying anything. Hey, I'm the best there is, the best there was, the best there ever will be. You remember that from the Breath the Hitman Heart. But if you don't get examples, then doesn't really matter. So let me give you a good sample answer right now. All right, so Idar, hopefully you will enjoy this answer, and we'll go over a few questions and answers in this live stream. And let me know in the comments below, and follow the channel Residency Corner for loads of interview Q&A videos that we have on the channel. Make sure you watch all of them. All right, so a good prepared answer for why internal medicine. All right. I chose internal medicine because of its intellectual challenge and the variety of patients and the conditions that it offers. And during my clinical rotations, I was particularly drawn to the complexity of managing patients with multiple comorbidities. For instance, during my internal medicine rotation, I had the opportunity to follow a patient who had both congestive heart failure as well as diabetes, along with renal issues. So managing both and multiple other conditions simultaneously required careful planning and coordination with other team members, and constant monitoring of the patient's daily changing health status. I, of course, enjoyed being able to think critically about how each condition impacted the other and developed comprehensive treatment plans, and on a daily basis assessing the different aspects between diabetes, heart failure, and the patient's kidney issues. And that was fairly interesting from at that level. Moreover, I love the continuity of care that internal medicine allows. Um, it allows you to develop long-term relationships with patients, and that is incredibly rewarding. And during a rotation in an outpatient clinic, I had the chance to follow a patient that I initially saw in the hospital for a hypertension-related complication. Over several months, I saw firsthand how our interventions helped improve his health, that connection from inpatient to outpatient reinforced my desire to be in a field where I could work with patients over time and see the impact of my care. And finally, I appreciate that internal medicine offers so many subspecialties. While I am still exploring my options, I'm particularly interested in endocrinology and how it relates to managing chronic diseases such as diabetes. So, internal medicine provides the opportunity to keep learning and growing, both in general practice and throughout in the future in specialization, which is going to be important to me. Thanks for asking this question. Well, what do you think? Hopefully, hopefully I prepared adequately for this response, and hopefully this was adequate. What do you think? Let me see if there are any. All right. So yeah, how was that question? If anybody has any feedback for me, because we're all learning, but I want to give you guys a sample answer, which I think you should prepare something similar. Um, and of course, you can always check out. I will have some templates as well for you to plug and play based on your situation. Anyways, I would want to go further, and let's talk about, not just internal medicine. Let's talk about family medicine. How would a family medicine interview candidate answer a similar type of a question? And I do believe that a lot of people who apply to family medicine, that apply to internal medicine also apply to family medicine. So let's touch on this question: why, uh, why did you choose this specialty? Why family medicine? Okay, so I'm going to give you again a bad answer of a person who is not prepared, and I don't want any of you who are watching right now or in the future to give a bad answer, but I'm going to give you an example of a bad answer so that you can see what makes it a bad answer. All right. And then we'll give you, as usual, a good sample answer. All right. Now the bad answer. Okay. Let me just see. People are here. Yep. All right. Great. Excellent. Okay. Bad, unprepared answer on why family medicine. Well, I think family medicine is good because it covers a lot of different things. And I like the idea of treating everyone. It's a bit more relaxed compared to other specialties, and I feel like it gives more freedom. Plus, I don't have a choice on I don't have a choice on a specific area of medicine, which is nice. I could be a generalist. Well, again, this is definitely a bad answer. Too general, not organized, misses key aspects. It doesn't address the core elements of family medicine, such as the continuity of care, community impact, or patient relationships. It sort of actually minimized or diminished the importance of family medicine. And yeah, it lacked passion. So yeah, bad answer. Bad answer. Let's go for a more prepared answer of why family medicine. Okay. All right. Let me get myself ready again. Okay, smiley face. Oh, I got braces. Braces don't help, right? But anyways, Family medicine appeals to me because of the opportunity to develop long term relationships with patients and their families and to treat a wide range of conditions across all age groups. And during my clinical rotations, I had the privilege of working in a family medicine clinic where I managed care for multiple generations of a single family. For instance, I cared for a patient with diabetes, her teenage son who had asthma, and her elderly father who was dealing with hypertension and heart issues. I loved the continuity of care that allowed me to understand their health in context of their family dynamics, and the community in which they are living in. Another reason I'm drawn to family medicine is the opportunity to practice preventative care and address health disparities. And during my community health clinical rotations, I was involved in a diabetes prevention program for the underserved population of the area. And I witnessed the positive impact of early interventions, and preventative care on community health. And this all reinforced my desire to practice in a specialty that emphasizes holistic care. And tend to combine allopathic with proven modalities of the natural world as well. Finally, I'm of course excited about the diversity of practice that family medicine offers, whether it's performing procedures, managing chronic illnesses, or providing prenatal care. I love the idea of being equipped to handle whatever walks through the door, and medicine allows me to serve as a comprehensive first line provider for a wide range of health issues, which is something I am truly passionate about. All right. So, what do you think? Was this a reasonable, much better than the answer that I had earlier? All right. So yeah, there. I have another person who has a comment, Mr. Fadi Isa, if I have your name correct. All right. So yeah, we are all here together, and we are all here to learn. All right. So yeah. So I'm giving some sample questions and answers, and I do believe that you really need to, since you're starting off with your interview preparation these days, you really need to see some samples, some examples. And I've seen this over the years that I have been training candidates for the residency interviews, that their first few interviews ended up failing and they had no idea what they were doing, no clue about how they're going to answer, what are they looking for. And they would come to me after flunking or being completely lost in their first few interviews, that they came to me and said, hey, okay, can you help us in preparing for your interviews? I said, okay, what happened in the first few interviews? And it ended up that, okay, they took it too casually. They did not think that they need to prepare much. And when they realized that they were asked questions that they should have easily known answers to, um, that they realized that, okay, yeah, now they really got to step up to the plate and make sure that they're prepared, that they're prepared for for these interviews. Like everything else, you've spent so much time with your USMLE steps, your clinical rotations, everything else, and then what happens that you're not ready for your interviews. So that is what you don't need. You don't want to do that. You don't want to waste your first few interviews. You waste your first few interviews, then that's a lot of money down the drain. That could make the difference between you actually matching and not matching. All right, let's do another question. And very important these days, handling ethical questions in your residency interviews. Okay, so um, yeah, ethical questions are a huge part of a residency interview, and especially for IMGs who have not been acclimatized to the US medical system, um, that you may not answer them appropriately. All right. So let's look at an ethical medical question, which is tell me about a mistake, an ethical interview question, that which is tell me about a mistake that you made in patient care and how you rectified it. So you made a mistake, you made a mistake, and how did you go about dealing with it? All right. So very important question. And they ask this, and we are not able to answer these questions appropriately. All right, let me give you a wrong answer first, right? An answer that I don't want any of the people who follow me to make. A bad answer would be, well, I think I'm pretty good. I don't really make mistakes. If I do make a mistake, I try to fix it and just move on. I think that's reasonable. And yeah, I think I'm pretty good. I think I don't make many mistakes. All right, that was a bad answer. Okay, so that's not gonna fly in an interview. You're not being genuine. You're not giving an example, and you're looking very wishy-washy. Okay, so let's talk about a good answer that you will provide. All right. Okay. All right. Let's do this. All right. During my rotation in ICU, I do remember a mistake of a dosage of a medication for a patient, and I was responsible since I was part of the admitting team and I was the first person to interview the patient. I was responsible for double checking the medication dosages of the patient's home medication. But in the midst of a busy shift, I missed an error, and the patient received a higher dose of amiodarone. I ended up giving the patient 400 twice a day, and I soon realized my mistake. And I immediately informed the attending physician, and we closely monitored the patient for any adverse effects. Fortunately, the patient did not receive any harm. Then I took steps to understand how the mistake happened. I reviewed the incident and I realized, of course, that I should have taken a proper history and double checked and cross checked the patient's medication list with a third party or the pharmacy, perhaps. We identified that a high workload and interruptions were contributing factors. However, that does not minimize the importance of appropriate patient care. And to prevent further such errors, I implemented a personal mental checklist to double check dosages, and we encouraged all of our team members to look at these things in detail and realize the importance of reconciling medications properly. And this experience, of course, taught me the importance of paying attention to detail, effective communication, and creating systems to prevent errors. It also reinforced my commitment to patient safety and continuous improvement. Thanks for asking this question. So, what do you think? So, what do you have to do with these type of questions? Acknowledge your mistake. All right. Don't say, "Hey, I'm the best there is, the best there was, the best there ever will be." Don't say that. Acknowledge, and everybody can make minor mistakes here and there. All right. Then in the answer, you will also mention what actions you took. You took immediate action. You noticed your issue, you rectified it, and you ensure that the patient is safe. You monitored the patient appropriately. Okay. And then you demonstrated that you are learning and you're improving. So you described that you learned from your experience and that you implemented changes to avoid similar things from happening in the future. Okay, so yeah, so what do you guys think? Um, so I demonstrated 3 questions and answers in this live session. Hopefully, this has been helpful. Why internal medicine? Why family medicine? And we demonstrated a ethical question. All right, so you understood. Let me know in the comments if you have any further questions that I can look to address. And if you're looking for a list of 25 questions, 25 questions with sample answers, let me get you a link where you can get 25 questions with their sample answers, and that will help kickstart your interview preparation. All right, so let's get that over in the comments. Let's get that over in the comments. All right, and if you are looking for any type of additional training, you can check out more of a detailed program with templates and everything else. All right, so, and of course, I have loads of videos. I have loads of videos on YouTube to kickstart your residency interview preparation. All right, so I think let me go over let me go over another question, and let me see what question should I go over. All right. So, um, one question that everybody needs to be prepared with is, for example, your strengths or your weaknesses. Okay. So that is a very, those are questions are very common, and um, people tend not to do them properly. And your strengths and your weaknesses question, they're there to judge you. Okay. Because sometimes you may think, okay, if I really give out my weakness, then that's going to be a problem. And so you have to be really tactful how you are looking to handle these types of questions. Or if it's a strength, you don't want to be too boastful. All right. So let's talk about strengths. Okay. So I'm going to give you a bad answer, and I'm going to give you a good sample answer. All right. Okay. All right. So what are your three biggest strengths? All right. Bad answer. I guess my strengths are that I am hardworking, I care about my patients, and I work well with others. I'm always willing to help out when needed, and I think I'm pretty good at managing my time. I try to stay organized, and yeah, I think these were my main strengths. Again, this was not giving any examples, no depth in this answer, right? And this was a missed opportunity, because this type of a question gives you an opportunity to actually make them make them realize that how important you are. Okay, so now let's go over a good sample answer. All right, so um, let's start. Well, thanks for asking this question. And I know that something like this would come up. So I did think about my possible three strengths. And I believe that my biggest strengths are communication, adaptability, and teamwork. First, strong communication, the number one, is essential in internal medicine, especially when coordinating with multidisciplinary teams and ensuring patients fully understand their treatment plans. For instance, during one of my rotations, I worked with a patient who was anxious about a procedure. I took the time to explain the process clearly using visuals, and I looked to simplify medical jargon, which helped ease the patient's anxiety, and it led to building more trust. And that experience reinforced the value of effective communication in improving patient outcomes. Second, I mentioned was adaptability. Adaptability is something I've relied on throughout my medical school. And during my clinical rotations, I had to quickly adjust to new environments and patient needs. For example, while working in a rural clinic, I had to manage resources carefully. We had a basic health unit that I worked in assisting with, and I had to be on my feet. And we had limited access to specialized care, and we were able to manage pretty nicely. And we did ended up transferring patients who were a bit sicker out to more tertiary settings. However, I relished that type of an opportunity, and this experience helped me develop resilience and creativity in providing care, even under very challenging circumstances. And the last point I mentioned was teamwork, and teamwork is a strength that I highly value. And medicine is of course a team effort, and I have always focused on building good working relationships with my colleagues. In one case, while managing a critically ill patient, I collaborated with nurses, respiratory therapists, fellow residents to ensure that we delivered comprehensive care. And by leveraging each team member's expertise, we were able to stabilize the patient and develop an effective plan. And I believe strong teamwork not only improves patient care, but also creates a positive working environment. So, these strengths of communication, adaptability, and teamwork have been essential in my growth as a medical professional. And I do look forward to applying this in this residency program in the future. Okay. So, yeah, this gives you an idea how, in my viewpoint, how you should be preparing for your interviews. All right. So, let's see. Okay. All right. So, okay, so we have a few questions here. All right. So, Fadi has a question. Fadi has a question. What does your friend hate about you? Okay. Well, that is a good question. And that is actually a good question. And those are questions that they use to redirect, to come out at a different angle. Okay. Those are questions that they pose so that they are able to confuse you a little bit. That's why you need to be prepared with so many answers, that whenever something like this comes out at you, um, that you are ready for them. So why does your friend hate you, right? So let's think about this. Finally, very good question. And if you have more questions like this, let me know, and we can look to address these types of questions. So let's think about this. I think you would need to be honest, okay? And this has to be something that only your friend can know about, or at least in the clinical setting, perhaps, right? But so let's try to give you a bad answer, and then I'll look to come up with a bit of a good answer. Okay. And this issue cannot be so bad that they say, okay, you are not fit for a residency program. So what I like to suggest is find something that is not as bad, but can potentially turn out to be positive. And not only positive, it will also uh, demonstrate your will to improve. Okay, so let's think about what a, a candidate who is not prepared will say. Okay, okay, bad answer. I don't think my friends really hate anything about me. Maybe sometimes I'm a bit late to things, but that's not a big deal. Honestly, I can't really think of anything. All right, I know. So that's probably a bad answer, right? It really avoids answering the question directly. All right. And there's no real self reflection, no demonstration of self awareness, or willingness to acknowledge flaws, right? So I need to have some water. I don't have any water. Anyways, a good prepared answer would be, let's think about this. So all right, so let's give it a try. Well, my friends sometimes tell me that I can be overly detailed oriented, which can make it should make me a bit slow to make decisions. For example, when we were planning trips or group activities, I tend to spend a lot of time researching and making sure every detail is perfect. While this can be frustrating for them because it delays decisions, I've learned that that it's the same trait that helps me be a thorough and a careful person as a physician. And during my clinical medicine rotations in internal medicine, I noticed that this tendency to be detail oriented helped me catch small but significant changes in patients' lab results or physical symptoms. For example, if you're looking at a patient with anemia, I would not just look at the hematocrit. I would look at the MCV, MCHC. I would look at any investigations done previously or the investigations that we need, and I think that helped me. Um, so I've also worked on balancing this tendency by making decisions more quickly when appropriate. So you of course always have to see what requires how much amount of time. You can't spend a million hours on something simple, right? But I believe this aspect of my personality is something that some people may find um, a little difficult to deal with, that I may focus on something that they may not want to focus on. But I believe this has helped me generally, especially in my in my so far in my experience in my clinical rotations, and I believe that has helped me from the medical standpoint. Hopefully, yeah, I think that is something that I do believe my friends have told me in the past. All right, so Fadi, what do you think? And do you think this is a reasonable way to approach this? I think anything reasonable what should do. All right. So yeah, so we talked about a couple of good question, Fadi. Good question. Anybody has any further questions, let me know, and we'll try to do this live. So we went over, people who are just joining now, we went over the question, why internal medicine? We had a sample answer. Then we went over why family medicine, and we had a sample answer. Then we went over an ethical question about, tell me about a mistake that you made. All right, an ethical type of a question. And then we went over a question, tell me about your 3 strengths. All right, and then we just talked about Fadi's question about, um, that what does your friend hate about you? Okay, so we did a couple of questions, and um, Idar has, let me show this question, has a question for us. Thank you for the live, my pleasure. What if I applied for IM and family medicine programs to the same hospital and asked about that during the interview? Okay, so this is a very common issue that people do have. They may be applying for internal medicine and family medicine. So um, this is how I would respond to you on this. So be careful. If, for example, the internal medicine program director or the coordinator somehow got in touch with the family medicine team, that is a rare scenario, but I would say that may happen, although I don't think that is that likely. And yeah, I would look to avoid that from happening, right? Don't apply to the same program, same hospital in internal medicine as well as family medicine and psych perhaps, or med peds. I don't think you should do that. There's every chance that they could, somehow find you, or you're walking, or um yeah, I think these days, back in the day when you were physically walking, I think this was more of an issue. But these days with online interviews, I think it's probably less of an issue. So I think he should be okay, but don't take my word on this. Only way you will get in trouble is if you apply to the same program. If you apply to 2 programs in the same hospital, and they're able to pick this up. All right, I would think they will not pick it up unless they're like friends and they'll look at interview lists from both internal medicine and family medicine, unless their programs are combined somehow, which normally may not be the case. So yeah, just be careful. It could be more problematic if you went through a source that got you an interview. It may be more problematic in that sense, because that source may talk to one program director and may know the other program director perhaps. So I think it depends on you how much you want to risk this. In a way, um, I don't think it should have huge consequences, because it's not illegal. It's definitely not illegal. So it's not something that you can that they can go to they take you to court, or cancel your eras token, or you can't apply to residencies anymore, right? But yeah, there's a small chance that they may coordinate with each other or talk to each other about the residents they're seeing or the applications they're getting. That's a small risk, but very good question. All right, so we talked about a few questions and answers. And yeah, let me know. Check out I have so many videos on my channel, so go through the videos. I think that should kickstart your residency interview. And I did share the link of the 25 most common questions and some sample answers, as well as a link to the Residency Corner website, where you're looking for more help. You will find more things that may be suitable for you. Anyways, let me know what you think. Hopefully this was helpful. We went over 4 or 5 questions, and this will of course be saved on YouTube, so you can rewatch this video, and hopefully all of this help. Thank you so much for watching. um, Dr. Umar Khan here. Done with my internal medicine residency, and I've been helping candidates with the interview preparations. Hopefully my channel has loads of videos for you to look at. Thank you so much, and we will look to schedule more interviews Hopefully more on the weekends. Hopefully more on the more interview live sessions more on the weekends. All right. Thank you so much. Talk to you guys soon. Bye bye.